Endeavor Health has been an early adopter of patient-reported outcomes and one of the first health systems to actually partner with PatientIQ. Can you share how PROs initially took root at Endeavor through research and how those early efforts helped build the case for broader adoption across the organization?
Yeah, thanks, Matt. And go figure, once you have the almighty dollar at play, things begin to change. For those that don't know Endeavor Health, so we are formerly North Shore University Health System. We're now a 9-hospital system on the North Shore of Chicago in the western suburbs. But I will say, I've been part of the story with Matt going a long way. My piece of trivia is Matt actually worked with me at Endeavor Health when it was North Shore University Health System in our sim lab. And I think that's really where the idea of patient-reported outcomes really took off, because we saw that, through research and using standardized tools like PROMIS, Who's Who's, and Ortho and Spine, we actually could get insights from these procedures that could actually change the way that we approach surgical technique. And I believe this research, going back through my notes here, I think it was led by Dr. Rich Wixom, and he generated a ton of publications and national registry collaborations for us. So it gave us this position, I think, that was unique for Endeavor because we had a large catchment of patients. And we don't do a lot of wet lab research, but we do have a lot of population level data that needs to tell more than what's on the surface. And so for me, I viewed that it really gave us a signal that PROs were more than just like a satisfaction survey. It actually showed us that they were true indicators of quality and value. And it seemed like there were more interests coming from societies to learn more. So from that, initial work that we did, we started thinking about how these PROs could connect with other data sets, because ultimately the goal here is to bring all these massive data sets together to power new research. And I think one of the early areas that we leaned into was really connecting this to anesthesia and pain management. And so what we did is we started to bring the PROs with our EHR and pharmacy data, and they started to do predictive modeling around pain trajectories and even predict who might need more support or be at longer or at risk for a longer use of opioids. So, I mean, talk about the crisis that was happening across the country with opioids. And this was really information that could be used in real time. And so to me, that's really the bridge between research and innovation, where we're using the patients, their voice to inform like predictive models, like this is amazing stuff to personalize care. Since then, we've done some things in women's health and behavioral health, looking at postpartum, pelvic health, menopause. And that's really helping us start to think about how you can use this data to inform more than just traditional clinical metrics that don't capture that full patient story. So to round it out, I would say research probably was a proof point for us. It built the evidence, it built the credibility, and probably more than anything, it built the learnings to secure cultural buy-in from our clinicians that we needed to have the patient's voice represented. And so now I view them not just as research tools, they're actually an enterprise-wide objective measure of impact and improvement, and that's a lot different than anecdotes.